Getting your COVID-19 vaccine is the best way we can all help end this pandemic. The vaccine helps prevent you from getting COVID, and it also prevents you from getting seriously ill if you do catch the virus. The more people who get vaccinated, the more quickly we can return to those indoor and outdoor activities and services that we all miss so very much. I know I'm looking forward to that. Getting vaccinated is a personal choice, and we're all here to provide you with the information you need to make an informed decision.
There are some rumors floating around about the COVID-19 vaccines, and we're here to set the record straight. None of the COVID-19 vaccines contain the live virus that causes COVID-19. This means that a COVID-19 vaccine cannot make you sick with COVID-19. COVID-19 vaccines do not change or interact with your DNA in any way. Additionally, COVID-19 vaccines do not contain microchips or tracking devices. Vaccine ingredients include mRNA, fats, potassium, organic compounds. They do not contain pork products, eggs, latex, or chemicals, and are quickly broken down by our cells.
When you get your COVID-19 vaccine, you'll be asked for your name and birth date. Please know that we will not be sharing that information with any other agencies or organizations. We use that information so that in the event that you lose your vaccine record, you'll be able to track that down. Keep in mind that vaccines are given to anyone interested. No insurance is needed, and all vaccines are free. We welcome all community members, so if you're undocumented and do not have citizenship, you are more than welcome to receive a vaccine.
After you get your shot, you might experience some short-term side effects, anything from a sore arm to muscle aches, tiredness, maybe a headache, even chills. But that is a normal response. That is your immune system generating antibodies and the protections against COVID-19. And these are short-term. They typically go away within 48 hours. Many people don't experience any side effects at all. And if that's you, don't worry, your body is still generating that much-needed immunity against COVID-19. I understand that the possibility you might be the someone who experiences one or some of those side effects can make you hesitate. It did for me, but I promise you it's well worth that gamble to protect yourself, your loved ones, those around you from this very serious illness and the long-term side effects that we now associate with having had a COVID-19 infection.
Along with masking, good hand hygiene, avoiding crowds, vaccination is our most effective tool for ending the pandemic. Until we achieve 70 to 80% of the population with herd immunity, this virus is going to continue to mutate and it likely render the vaccines partially effective or ineffective. There has been increasing concern about long-term complications from COVID-19. A recent study involving 236,000 individuals with history of COVID found that over 1/3 of that group has developed long-term disorders of the nervous system along with mental health disorders. This contrasts with influenza and other respiratory infections caused by viruses that have very low complication or long-term effects. I urge you to get vaccinated to protect yourself, others, to prevent acute illness, as well as avoid the potential long-term complications of COVID-19.
I got my COVID vaccine several months ago. I'm a first responder, so I was able to get a COVID vaccine quickly. And I was really happy to get my vaccine. I've had family members who've been hospitalized due to COVID, and I did lose an uncle to COVID. So I know how serious this virus can be, and I am happy that I got my vaccine. It also allows me to be out with people, not be wearing a whole bunch of gear, and just a mask like this. I can hug people now. It's just been really great to have it. It made my arm a little sore, for sure. That doesn't last more than a couple of days. And I had a slight headache with the second dose. It also went away, and I could take Tylenol for it. So I highly recommend it.
I received the COVID-19 vaccine because I think it's important for us as a community to get back to some normalcy. I did my part by receiving the vaccine so that we can create a sense of community again, get back to our services, get back to family and friends, and some of the activities that we used to do before the pandemic. It's important for us all to be in this together, and I did that by my part by getting the vaccine.
I received my COVID-19 vaccine a couple months ago. I have to admit, I was a little nervous at first when I was going to go in and get it. I did some research and found out that the benefits definitely outweighed the risk. I wanted to make sure that I was helping to keep my family, myself, and my community safe. And I was also encouraged by the fact that the more of us that get vaccines, the sooner we'll return to normalcy and a sense of community. I miss seeing all those wonderful faces.
I was initially hesitant when I went to get a vaccine, but I did a lot of reading and research and discovered it was both safer and more effective than I had initially believed. With my first shot, I had a sore arm for maybe about a day, and with my second shot, I had no negative symptoms at all. In fact, I had more energy the day after that. With loved ones who are high risk and vulnerable, I felt very powerless with this pandemic. There was nothing I could do to help protect them. This vaccine has finally given me something that I can do, something actionable that not only protects me, but those around me.
As a physician, prior to taking the vaccine, I reviewed extensively the history and the production of these mRNA vaccines. This technology has been used for years in fighting cancer. It's just that this particular vaccine is the first application of using that technology. As I've looked at the potential risks of the vaccine compared to the risk of contracting COVID-19, it's clear in my mind the safest route is to get vaccinated.